I have never seen a product that says skin bleaching on it. It doesn't exist. Nobody uses that word on their product because they know it comes with a connotation. But you do see a lot of products like tone, fade, white, glow, Egyptian for some reason. Those things are really, really in high demand.
Dr. Folakemi Cole-Adeife, and she's a consultant dermatologist and clinical researcher with a strong focus on dermatology in African populations. Her work centers on equitable access to skincare, global health dermatology, and improving clinical research and care for diverse skin tones.
Quite a number of women in Nigeria lighten their skin. In my practice, it's between 5 to 7 out of every 10 women that are using some kind of skin lightening agent. The soap, the cream, and it's quite concerning. A lot of people don't even know that what they're using is a lightening agent. Mercury lightens the skin, but mercury also damages the kidneys, can cause kidney failure if used for a long time, and it can also affect the nerves. So people who are using mercury-containing creams, they have tremors, their hands are shaking, and it can also cause some kind of psychosis where they feel anxiety, depression, and abnormal behavior.
I would love you to take us through the process of how you approach clients who come to you and tell you, Dr. Cole, I want to stop, especially when there's this whole idea of shame and fear. Hi, my name is Olabanke Oyinkansola-Goriola, and I'm the founder and the executive director of the Shade Initiative. And today we have our guest, Dr. Folakemi Cole-Adeife, and she's a consultant dermatologist and clinical researcher with a strong focus on dermatology in African populations. Her work centers on equitable access to skincare, global health dermatology, and improving clinical research and care for diverse skin tone. So, Dr. Folakemi, can you please introduce yourself?
Okay, my name is Folakemi Cole-Adeife. I'm a consultant physician, dermatologist, and venerologist. I work primarily at the Lagos State University Teaching Hospital in Lagos, Nigeria. I love to dance and a dancer, but of course, primarily a dermatologist working in global health dermatology and clinical dermatology.
So my first question would be, why dermatology amongst so many other things?
Well, as a child, I think I had problematic skin. I had eczema, I had a condition called papular urticaria, where you have insect bite allergy. I had acne as a teenager, very severe acne, and as a young adult as well. And so I found myself always having skin-related issues. And I guess I just wanted to try to understand the skin better, and I know how those skin conditions affected me and psychologically, and I realized that in a lot of these skin conditions we tend to overlook how they make people feel, and that's important. Most skin conditions won't kill you, but they do affect how you feel, and it's important to take them seriously. Also, I come from a generation of dermatologists. My mother was a dermatologist, so I think that also played a major role in had a great influence in me becoming a dermatologist as well.
Yeah, I know when it comes to the conversation surrounding skin, I know it's not something we do a lot. And I think it's just recently that everyone's trying to articulate what they think about skin, especially when it comes to, oh, I have a skin condition and I have to go check it out. So my question would be, how is skin discussed in Nigeria compared to all other places? Because I know you've traveled far and wide.
So, well, in Nigeria, skin is just now being understood as a part of medicine. The skin is the largest organ in the body. Before, a couple of maybe years ago, people felt the skin was not a medically related concern at all, and it was in the purview of beauty and cosmetics or aesthetics.
Yeah.
And so everybody felt if you had a problem with my skin, I could either treat it with home remedies, or I could go to the beauty salon and get it treated in Nigeria. And up until very recently, most people were not aware that there are actually medical doctors that are specialized in treating the skin, hair, and nails, and that you can actually go to a hospital or a clinic when you have a problem with your skin, hair, and nails. Most people would think, if I had a problem with my hair, when I go to make my hair, I'll ask the hairstylist what I can do. And the same with your nails. You go to the nail tech, a lot of people are just beginning to realize that these parts of the body, they're just like other organs. Your kidney, your lungs, your liver, your brain, and it needs to be treated as such. And so the ideal thing is to see a doctor that specializes in managing the skin, hair, and nails. And that's a dermatologist.
Oh, thank you very much for that explanation, because I know many people would... I think the first time I actually thought about dermatology, I actually thought it was just about skin. I never thought about hair and nails until when I wanted to buy like multivitamins, and I see that there's this combination of skin, hair, and nails.
It's the skin and appendages. So the nails and the hair come out of the skin. So they are taken as part of the appendage, the integument system.
Speaking of skin, one of the things we focus here at the Shade Initiative is actually to advocate against skin bleaching practices, and also to talk about skin tone discrimination that we know as colorism. And for many people who don't know what colorism is, the academic definition would be the prejudicial or preferential treatment of same-race people based solely on their color, which means within the same race, the lighter skinned people are accepted and considered more superior compared to their dark skin counterparts. So that is what skin tone discrimination is. It leads me to my question. How would you define skin tone discrimination within the Nigerian context?
So in Nigeria, we do have issues with colorism. Right from, it's actually very much entrenched and embedded in society and societal norms. Sometimes you see parents coming to you saying, oh, my child is fair, but the younger sister is dark. I want her color to be like, and like, they're both beautiful, adorable children, and they have their unique skin tones. And then my friend who has a light-skinned daughter says she feels her daughter is treated preferentially in school by the teachers. They always make her the class captain, or they always, exempt her from punishment. And even though she realized that her daughter was kind of treated preferentially, she had to call the daughter aside and say, this is not right. But some other people would look at it the opposite way. They would say, oh, I want my daughter to be treated preferentially. So it does exist, and it's a cultural thing. It has some colonial undertones, because we still have that idea that light skin or white is better or more attractive or superior, or has a higher social status than darker skin. And that has kind of crept into society, and so a lot of people believe that. And so we need to kind of find ways to address that and make people know that all skin colors are beautiful, not just light skin. We deal with that a lot, and that's one of the reasons, one of the major drivers of skin bleaching, because people want to be as light as possible, because they associate light skin with more beauty, with a higher social class, more job opportunities, more marriage prospects, and this is very common in Nigeria. As you know, Nigeria is one of the bleaching capitals in Africa. It also shows up in some cases of employment, and we know that there was a time certain organizations were only employing light-skinned people, and that has kind of changed now. But there was a time that a particular bank was notorious for only employing light-skinned both men and women. And so most people, even billboards, you would see a lot of the billboards had light-skinned people, and these are some of the things that have influenced society to believe this is the standard of beauty. And so everybody aspires to be light-skinned, whether you are naturally light-skinned or not. And so this is something that in our society has become more and more common. I think in recent times there's been a pushback for from various circles for us to embrace our skin color, no matter what skin color it is.
Yeah. Talking about how it has become more common, I just remember a time when a friend of mine would tell me, oh, the reason why I doesn't watch movies is because all the ladies look alike, because every single person has bleached their skin and you can't even differentiate one person from the other. So it just kind of makes me think that wherever you go to, you just see everyone that at a point you just realize that where are the darker skinned people?
I think sometimes it's not even just their actual skin color, it's also permeated into makeup industry and lighting industry. So you find that even when a person is dark skinned, the lighting tries to make them fairer. And the makeup tries to make them fairer. So at the end of the day, everybody looks
the same.
Light.
Yeah.
Because we've all been programmed to believe it's more beautiful.
Yeah.
And so that's why probably movies, even the lighting and the production, try to make people look
the same,
more light skinned than they are. So yeah, we need to be able to just have a step back, rethink, reorientate, and try to look at the beauty of black skin. Every single shade is beautiful, and we don't all have to aspire to be one particular skin tone or a lighter skin tone.
So how does colorism reflect in the clinic? Because I want to believe you have a lot of clients who walk into your private practice who want to do one thing or the other.
Not just private, the teaching hospital where I work primarily too, we have people coming in and saying, "Doctor, I am dark and I want to be lighter. What can I use?" Or you recommend something and they say, "Hope it will make me dark." Say, what's wrong with being dark? And then we as dermatologists are seeing more cases of the adverse effects of skin bleaching. So we have people coming in with stretch marks, with very funny and extensive fungal infections, with difficulty with wound healing.
Yeah.
And these are all adverse effects of using long-term skin bleaching. And this is a big challenge because we find that some of this is irreversible damage. Some of this can be reversible, but a lot of the stretch marks, there's no treatment. Nothing can get rid of them completely.
But there are stretch mark creams.
Most of them are marketing gimmicks. Stretch marks don't have a cure. You can do procedures to make them look better, but they're still going to be there. And a lot of lightning creams, particularly steroid-based lightning creams, end up giving people stretch marks. So we find that a lot of people are coming in with something we call skin bleaching syndrome or post-bleaching syndrome. Yeah, it's a diagnosis I make every single day in my clinic. And all the constellation of the problems they have is as a result of skin bleaching. And so we're now seeing that some of it is not just on the skin, some of it is systemic, affecting other organs in the body. It may affect endocrine function, it may affect the kidneys, it can make people gain weight, sometimes hypertension, diabetes. And so we see a lot of people coming in with these adverse effects or complications of using skin lightening creams quite often. Yeah.
So before we go deeply into this, the health impact of skin bleaching, I want us to talk about the psychological part of it. How early do you think the idea of being light versus being dark, how early do you think it shaped people's perception?
Well, I think it starts from a very early age. And I've seen cases where a mother has a baby and while the baby is just born, they are busy discussing baby's skin color that has just been born, and they're saying, "Oh, look at the ears are dark, it's still going to be very dark, or this one is very fair, or it's so beautiful, looks like Oibo." So from that point, people are already, introducing their biases and their prejudices about skin tone. And like I said, sometimes when you have two kids, one is light skin, one is dark skin, you find that a lot of people start complimenting the light skin child, say, "Oh, she's so beautiful. Your sister is more beautiful than you." And so that begins from an early age to put some kind of bias
Mm.
or perception in the child's mind. And so we really need to reflect as a society,
Mm.
as do we want to be introducing those biases to our children.
Yeah.
I know in some cultures, when you want to get married to a bride, if the bride is lighter, you pay extra. Yeah, you pay extra for light skin, meaning that it's an added.
Mm.
So these are some of the things that
Yeah.
drive the perception and drive colorism and also skin lightening in our environment.
Yeah. Yeah. I think I actually agree because yeah, there was a time most of my friends who actually grew up within this whole idea that light skin is better, they actually told me that most of it started within the family, where they were being told, oh, don't go play in the sun, you will be dark, and if you're dark, you will look ugly, things like that. And I think one thing people or the society or parents or family members do not know is all those subtle words you think you're just saying, and
Yeah.
I'm just talking. You don't know some
It
people
does sow a seed,
actually,
yeah.
yeah, they actually
And
internalize
yeah,
it.
people also associate being darker with you're suffering.
Yeah.
So when you say, oh, you're stressed, why are you looking so dark? You're not eating well, any problem at home. Meanwhile, you may just have a tan, which is normal,
Yeah.
at certain times of the year. But our society has kind of associated being darker with
Yeah.
maybe you're suffering, you're not
And
eating
you see it in
right.
movies too, where
Yeah.
the poor girl is usually mostly the dark-skinned one, and then if they want to, show this, oh, very classy, very
They usually use a
beautiful,
light
a
skin.
light-skinned babe, and then I think that kind of gives this whole idea
It's
that
programming.
it's exactly.
It's programming. It programs the mind, and those are some of the things that are driving this. And then, of course, to be honest, we cannot overlook racism and the world perspective and how black-skinned people are treated all over the world.
Yeah.
And so most people want to be as far as light as possible to see if they can escape some of that prejudicial racist treatment and all. So we really, as a society, as the world, we need to think about and reflect on all those things.
Yeah. Because most times it's not even about the fact that, oh, I want to be white. It's like if I'm in proximity to a little bit of lightness,
exactly.
the kind of social currency it
social
gives.
capital
Yeah.
that people associate
Yeah.
with being lighter that tends to drive a lot of people to wanting to be lighter and go into skin lightening.
You know how bad it is now. I was watching one of those AI TikTok videos, and even within this AI TikTok videos, someone still used a dark skin as the bad person, the jealous friend who wanted to snatch someone's husband. And somebody said, you guys have brought colorism into AI again. And but when you think about it, it's a reflection. Thank you.
Thoughts and perceptions.
Absolutely.
So it's going to reflect what the creator thinks.
Yeah. Yeah.
And that's the thing. And even we can even take it as far back as whenever you see something black, you negate, you associate it with bad, negative,
and then white.
It's good. So you have whenever they are playing the devil
like, it has to be black.
And the angels and
definitely
God
white.
And always white. So those things program the mind and always put a negative connotation to darker skin tones and all. And then the fact that most of the parts of the world where you have darker skin tones are less developed than parts of the world where you have lighter skin tones. This is also something that drives, the colorism and racism. So those structural inequities also have an impact on how people perceive themselves. And everybody wants to be associated with success.
Absolutely.
And so that's another reason why we have this desire to have a lighter skin tone.
Let's talk about skin bleaching practices. And I know there's this WHO statistics that says 77% of Nigerian women use skin bleaching products, which is the highest globally. So, and when you think about the population of Nigerian women, what does that tell you? So, I think I'm forced, for the sake of people who are watching this, I'm forced to ask from a certified and expert that How common are skin bleaching practices in Nigeria?
Well, I would say they're very common, but they vary. So that study of 77% was done, I think, around 2002.
20,
It was
yeah.
done around 2002. And we're not actually not the highest in the world. There are some Asian countries that they are 80%. They are organs. But yes, actually quite a number of women in Nigeria lighten their skin. In my practice, it's between 5 and 7 of every 5 to 7 out of every 10 women
Wow.
that are using some kind of skin lightening agent, the soap, the cream, and it's quite concerning. So a lot of people don't even know that what they're using is a lightening agent. They just say, "I've been using it for a long time. It's for toning." And some people say, nobody admits to using skin bleaching products. Everybody's using a toning agent, or they're maintaining their skin color. I just use it to maintain my color, or I just use it to brighten a bit. And so there's that gray line, because I have never seen a product that says skin bleaching on it. It doesn't exist. Nobody uses that word on their product because they know it comes with a connotation. But you do see a lot of products like tone, fade, white, glow, Egyptian for some reason, mulatto, and those things are really, really in high demand. So we do have this challenge. And unfortunately, a lot of these products contain unsafe products, or even undeclared products like steroids, mercury containing creams, hydroquinone in very high concentrations. And these come with negative adverse effects both to the skin and to the general body.
Yeah. So can you tell us more about the kind of products people use? I know you mentioned mercury hydroquinone, because I've actually heard that hydroquinone actually treats fading. So how do people
of course,
use
it's
it for bleaching?
Hydroquinone is a drug.
Okay.
Just like steroids. As a dermatologist, I recommend topical steroids every day to manage various skin conditions.
Okay.
But one of the side effects of topical steroids, if you use it for a long time, is that it lightens the skin. And so people discover that steroids lighten the skin, and they are now using it all over the body to lighten their skin, mixed with their creams. Some mothers even go to the point of mixing steroid creams into their children or their babies' skincare products, because they want the baby to be fair. Not doing that is doing a lot of damage, because steroids are absorbed systemically and can affect, hormonal balance in the body, can affect blood sugar, blood pressure, can lead to conditions like adrenal insufficiency or Cushing's syndrome. These are serious systemic or endocrinological conditions. But a lot of people are unaware of this. It can also lead to thinning of the bones. There was a patient that needed a surgery, and when they wanted to put in the tube for the surgery, they found that the trachea, which is the windpipe, was so brittle that it couldn't withstand the intubation equipment.
So it's not just the surface level of the skin.
Not just the surface level. So that's what I say with things like steroids. Mercury containing products. Mercury lightens the skin, but mercury also damages the kidneys, can cause kidney failure if used for a long time. And it can also affect the nerves. So people who are using mercury containing creams, they have tremors, their hands are shaking, and it can also cause some kind of psychosis where they feel anxiety, depression, and abnormal behavior.
All from creams?
Yes, because of the mercury in it, which is also absorbed systemically. So sometimes when you see some slay mamas and their behavior is not neither here nor there, sometimes I wonder,
could it be the
she's using a mercury containing cream? But it's a possibility. Yeah, because these things can affect the nervous system and behavior. Mercury is very, very notorious. There's even a global convention about mercury. I think it's called the Minamata Convention. They try to reduce mercury in, products, skincare products, that because also it contaminates the environment, and also we don't want mercury at all, except in very minute quantities that's acceptable. And then you have hydroquinone, which is a medication that dermatologists use. We use hydroquinone to treat hyperpigmentation, but it's a drug. Just like if you are sick, you need antibiotics. You use the antibiotics for a period, and then you stop. You can't say, oh, because you're afraid of infection, you're going to be using antibiotics every day for the rest of the year.
That's true.
You're going to use it for 2 weeks, 1 week, and stop. And it's the same with hydroquinone. You can use it for 6 weeks to treat hyperpigmentation and then stop it. But if you use it for a long time, then it begins to give rebound hyperpigmentation. So the opposite of what it's meant to do. And that's why you see all the people having black burnt like discoloration on the cheeks, on the face, the knuckles, like we call the bally fingers. So those are usually adverse effects of hydroquinone when used in the wrong and unsupervised manner.
There's one I found out when I was doing a little bit of research. Well, not a little bit. I was doing research, and there's one called ochronosis, and I realized that skin bleaching products also make you smell. Is that true? Or?
Yes. So ochronosis is the dark blue-black discoloration. That's dark discoloration that you see a lot. If you go to Lagos market, you see a lot of women have it because everybody's using hydroquinone containing creams and they are sitting directly under the sun without sunscreen. So it's a recipe for disaster for the skin. Now, yes, hydroquinone also can lead to people having a fishy body odor. And that's because when the hydroquinone gets into the body, it breaks down into a chemical compound that gives the body a fishy, a fishy smell. And so sometimes people who are using hydroquinone, you can smell it on them because they have this unusual body odor when they're using it for a very long time.
This whole side effect that you just mentioned, because I feel like it's a lot it's a lot compared to the benefit you get. Well, maybe the instant benefit, of course, but compared to the side effects that's going to come up in few years. So why is it that despite all this campaign and all this education about skin bleaching and what it does to the body, people are still actively using it?
I think it's a mindset thing. I think people just believe that I'm lighter, I'm going to be more beautiful, I'm going to be able to marry a rich man, I'm going to get a better job. I have a social status of being light-skinned or fair. And that's, for a lot of people, that's more important than the adverse effects. But ultimately, most people, when they begin to experience the adverse effects, they stop. Because they realize that it's a short-lived benefit. Because at the end of the day, the beautiful skin you're looking for will be destroyed with different colors, patches here and there. And unfortunately, when people get to that stage, they feel very bad and it affects their confidence, their psyche, and they have to spend a lot of money trying to fix the skin. So unfortunately, for a lot of people, that occurs at a much later stage. If it's caught earlier on and they're able to realize that they stop, then the skin is forgiving. And you find that the skin will bounce back without long-term side effects. But if they've used it for too long, you reach a point of no return that you cannot reverse some of the damage done to the skin, and it's quite sad. But you have some people that despite the damage, they don't care. They just, there's dependency on skin bleaching. They've created an identity for themselves in a particular skin tone. And if they stop bleaching, it's going to change what people think they are. Because everybody knows them as a light-skinned person when they are not really light-skinned. It's just from bleaching. And when you stop bleaching and they change to a dark person, they are not able to withstand a lot of the questions and the comments that they get. So they just keep bleaching. So they are like dependent on skin bleaching. You do see people like that.
So thinking about this whole idea of I want to stop, because I know there are many people who tell themselves that, okay, I need to make a decision to stop this thing, especially when they are starting to see those side effects. So how do you approach clients? I would love you to take us through the process of how you approach clients who come to you and tell you, Dr. Cole, I want to stop, especially when there's this whole idea of shame and fear is involved, because many people feel like, people know me as a light-skinned person, if they see me in the next 2 months and I'm dark skinned, how will I, talk about it, or what will I say or defend what I'm
Yes.
doing?
So a lot of dermatology actually is psychology. We have to do a lot of
Mm.
counseling. We have to do a lot of talking, encouragement, and when I have people like that, we have to sit down, hold their hands, and say, look,
Mm.
your skin color doesn't define who you are. Your skin tone is beautiful in every shade. It's better to have healthy skin than to have light skin with a myriad of problems.
Yeah.
And people are going to talk. People are going to ask questions. That's just the society we live in. Everybody is nosy. And they,
True.
oh, what happened to your skin? Oh, you're looking dark. Oh, what's going on? Is everything okay?
Hmm.
And I tell them that you have to prepare for that and just blot out people's comments and just do what you need to do. Because the same people, if you have health challenges, they'll still talk. So you need to decide what is important to you. I try to get family support. For most people, once they have family support, it helps. So like their husband or their children, or parents, supporting them to say, oh, you look beautiful, you look, your skin is looking more healthy, more radiant. Those things help, and help to motivate them to continue because their skin color will change.
Okay.
And then a lot of people who have dependency on steroids, when they stop the steroid, their skin revolts. They have a lot of itching, irritation, acne, breakouts, and it takes a while for that to actually go away.
Okay.
So it's usually a very turbulent period. And sometimes patients cannot withstand it and they say, look, I'm going back to bleaching.
Okay.
Other times they're able to weather the storm, get through that difficult time, and then afterwards they embrace their new skin tone and love their color and are more at peace.
Okay.
Yeah.
So beyond, because I know shifting one's mindset is
It's very tough.
It's very tough to do. It's different. Yeah.
It requires a lot of counseling, a lot of social support.
So beyond family also, I think I would want to know what are the resources available for people who feel like I don't want to talk to my family about this, they will judge me. And how many people are you going to hold your hands every day?
Yeah, I think that's where foundations and initiatives like yours can come in.
Okay.
Because people need that support. People need that camaraderie, peer-to-peer education, people who have done it before and can share their experience and all. So I think that's where civil societies and NGOs and foundations can really help to support people who want to, transition from using skin-lightening products to embracing their natural skin tone.
Yeah. So in terms of societal pressure, when it comes to identity or belonging or trying to figure out who I am as a person, how does skin tone discrimination affect confidence, opportunities, and relationships? Have you seen it play out in some ways?
Oh, absolutely. I think because of the societal norms. So, for what I understand, most women, of course, it's not their sole aim for bleaching, but a major aspect to this is to be attractive to the opposite sex. And people believe that men prefer light-skinned women and they like fair women, or they find fair or light-skinned women more attractive. And I'm not sure if this is true. It's a study I actually want to do to ask men. Would they tell me the truth though? I'm not sure. But it's important to realize that a lot of people do feel if you're light skinned, you're going to have more prospects or more suitors than if you're dark skinned. And I've actually observed that in some parts of the country, people who are light skinned, they get married much earlier.
Yeah, there's a study actually.
That are dark skinned, and they get much earlier. And so this kind of is one major driver. You see people in relationships that maybe with darker skinned people, they may find that they don't feel that they're able to get into the relationship they want because of their skin color. And you have sometimes where the boyfriend or person leaves them for the light skinned person, or and the husband has a side chick
That
who
is
is
light
light
skinned.
skinned. And these things affect relationships a lot. So I think in a way, there may be some male preference to lighter skin tones driving this. Not all men, because some men do say skin tone is not um, something they look at. They look at other things. But from the data, it appears that there is some skin tone bias towards lighter women above our men.
Yeah, and you know what? This thing actually cuts across class,
Yeah.
because I think I watched someone's video sometime last week, and she's a market woman and she's actually bleaching her skin,
Yeah.
and she was like, "Ah, tori oko mi mo se n se o, tori oko mi mo se n se, mi fe ko water," and that just made me feel like, even though she's, I think she should be in her 50s or 60s,
Yep.
there's still that hold on her that I have to do this to keep my husband. I don't want him to look outside.
Absolutely.
And then I also saw another, like someone was doing all this vox pop on the streets and asking young guys questions. And they're like, oh, they would prefer a light-skinned babe because it reflects that they are taking care of her. So they want to show that they have money too. So I'm just thinking, okay, so it's not actually just about class, the lower class, the middle class, or the rich. It cuts across different.
Yeah.
And that's, I don't know, I think that's a study, and hopefully these are the studies I think we actually need to do in Nigeria, especially when it comes to data collection. I think we do a lot of research, and when it comes to data, we're struggling to like say, okay, we did this amount of research here in Nigeria and it says this. We tend to depend on data from other African countries, and I'm hoping this would change. But yeah, I'm thinking about, because when I think about skin bleaching, the first thing that comes to my head is how gender plays, and as well as class. And I'm saying this because I've seen many rich ladies bleach their skin, but they don't use the word bleach their skin. They tell themselves they are using vitamin, this is it IV thing, and they're washing their
wellness and detox.
Yeah, I'm washing my skin, I'm just cleaning, compared to the kind of, so I want us to talk about the words that different class we use to approach this whole idea of skin bleaching.
Yeah, so you are absolutely correct. Nobody uses the word bleach. So you never find anybody saying, I'm bleaching my skin. You have people saying, oh, I'm maintaining my color, or I'm, doing a glow
up.
Yeah, glowing up, or I'm doing a detox session, I'm rejuvenating. But, so depending on the class, the terminology changes, and sometimes people hide behind certain things too. For instance, the IV glutathione treatment is something I've studied as well.
Okay.
It has other benefits according to people who use them.
Okay.
But a side effect, or a wanted side effect, is a slightly lighter skin tone.
Yeah.
And so we really need to look at that and see, is this the reason why people are doing this, or they have other benefits they're looking into. And like you say, it cuts across. It's different agents are different for different classes of people. So you have the lower socioeconomic class using steroids, which are very cheap and available. And then you have people who have a bit more money using other, not as toxic, but still for the purpose of lightening their skin. So like alpha-butene or kojic acid, or things like that can lighten the skin beyond just treating hyperpigmentation. Because we use this to treat hyperpigmentation. But when the hyperpigmentation is gone, or you're using it all over the body, then that's a different story.
So you're no longer just treating the hyperpigmentation, you're like trying to clear.
So there's sometimes
the
a gray
skin
area between, I want to treat hyperpigmentation, I want to lighten
my skin. Yeah. Well, so when we now think about class, that means side effects comes faster for some people.
Yes, because of course some of the newer lightening agents are not as toxic. So they may not give you stretch marks, or they can cause skin irritation over time. But they're not going to give some of the very overt adverse effects that we see in the big three, that's steroids, hydroquinone, and mercury. But there are other adverse effects that may come up over time.
So now that we've talked about class, gender, and how it plays with within this whole idea of I need to bleach my skin, I need to look a certain way to be accepted. The question would now be, what does a culturally sensitive dermatology looks like in Nigeria?
So I would say in Nigeria, it's embracing all skin tones.
Okay.
It's understanding that all skin colors are beautiful.
Okay.
And helping people to love and respect their skin tone. It also means attending to the specific needs of darker skin tones.
Okay.
We have challenges with hyperpigmentation, which is something that drives people to bleach their skin.
Yeah.
In the study I did recently, looking at various reasons for skin bleaching, I realized that one of the major reasons was to get an even skin tone or to treat dark spots.
Okay.
So a lot of people start by wanting to treat dark spots, and then they now go down the rabbit hole of using it all the time. So we need to understand that treating hyperpigmentation is important to our people. People don't like the dark spots. Okay. If they have acne with dark spots, they want to get rid of the dark spots and not just the acne. So it's understanding that and being sensitive to that as dermatologists, that we need to address. We cannot just cut and paste recommendations for treatment for white people or even Asians. We have to have our own guidelines and recommendations for treatment in our skin tone and that address the peculiarities of darker skin tones.
Okay, so then my question would be, what role should doctors, organizations, because I don't think you can do it all by yourself, and if we're trying to kick this whole skin bleaching, kick it away out of our community or our society, what roles should doctors, educators, organizations play in addressing colorism as well as advocating against skin bleaching practices?
So it's more a social issue now. So it's not just a medical issue. It's a social, it's an economic issue, it's an identity issue. We need to engage a lot of these leaders, community leaders, community influencers to be able to get the message out there. Nigeria is a very religious country, so we need to engage our religious leaders. Get the religious leaders to speak about it on the pulpit, in the mosque, that every color is beautiful. You don't need to change the color you are. And get people to embrace that and tell mothers, don't try to change your child's color. Love all your children, whether they are black, whether they are yellow, whether they are red, as our Father in heaven loves us. And we need to get the society to ensure that advertising is not promoting colorism.
Yeah.
Every billboard, every media, every advertising project should always have adequate representation of all skin tones. So have the dark skin babe, have the light skin babe, have different representation being represented. The antagonist shouldn't always be the darker person. Sometimes the light person can be the bad person. So that we don't always have this idea that darker skin tones are bad and lighter skin tones are good. So these are some ways we can change our mindset as a people. And then even beauty pageants. I'm happy that in recent times, most of the Miss Nigerians haven't been very fair-skinned people. They've been, in between colors, which is good. So we realize that the most beautiful women in Nigeria don't necessarily have to be the lightest women. You can have a beautiful woman who is light, yes. You can also have a beautiful woman who is an ebony black dark beauty. And that representation is very important.
Yeah, and not just also in movies and even in churches.
In churches, in billboards,
organizations,
in
banks,
video vixens, banks, politicians.
Yeah.
I've noticed that a lot of women politicians bleach their skin. And it's quite unfortunate because people look up to our leaders. And if every woman leader you are seeing is, has evidence of skin bleaching, it's going to have an impact on people coming behind them.
Yeah. I just remembered I think I read an article about the beauty tax expectations from women. It just makes me feel like this expectation that you need to look a certain way And then if likeness is what is defined as attractiveness, then you would also want to play within the circle of that.
Absolutely.
So the next question is, if you could change one belief Nigerians hold about skin tone, what would that be?
It's just a belief that certain skin tones are more beautiful because all skin tones are beautiful.
Okay.
I was watching an interview today of Lupita Nyong'o, and I was just admiring her skin. She's so
Very beautiful.
elegantly, exquisitely beautiful in her dark skin. And I think it's us being able to appreciate beauty in all skin tones. I mean, white skin is beautiful. Asian skin is beautiful. I'm not the person that believes only black skin is beautiful. I believe all skin colors are beautiful.
Yeah.
What you need to do is love and nurture whatever skin color you're
There
in.
you have.
And it's strange because animals don't have this problem. I mean, I see dogs and they play together, the black dog, the white dog, the brown dog, everybody. There's no
Hierarchy.
hierarchy or discrimination with color. So we're, as human beings, we're supposed to be the most intelligent beings on the planet. But this segregation with skin color is not a reflection of intelligence at all. And if even lower animals don't have such prejudices, why should we as sentient beings be battling with this kind of unnecessary skin tone is just a reflection of adaptation for your climate. It evolved because in Africa the climate was hot, and so we needed more melanin. And in Europe the climate was cool. They needed less melanin. And that was the adaptation that led to skin color.
So, in the spirit of the International Women's Day, what advice would you give women globally when it comes to beauty as well as their skin tone?
Women are beyond beauty, beyond the physical external beauty. Women make the world go round. Women are powerful. We literally bring life into the world. We birth babies, nurture them with our bodies. We work and jobs. Women are the pinnacle of their careers. I think women should be respected and loved beyond just what they look like physically. And then even with the physical appearance, it's so diverse, and that diversity should be embraced. There is no one size fits all for women. We come in different shapes, sizes, colors. We come in different heights, lengths, and we should be celebrated in every form that we come in. And that's my advice. We're all beautiful, we're all amazing, and we need to just love and embrace ourselves as women.
So yeah, thank you. So basically, women were beyond our physicalness.
Definitely,
we bring too much to the table.
Bring
beyond
too much to the table than just a skin color or a shape or a body size. We're much more than that.
As a doctor, how would you talk about, or how would you approach regulation in Nigeria?
So I would say for skin lightening products, we need stricter regulation. Unfortunately, we have a lot of dishonest marketers and sellers. They would declare one thing and sell something else. So I'm sure what they declare to NAFDAC is totally different from what is in the market. And so that's why we need cosmetovigilance. We need an agency that will just walk into the shops, pick up things that are being sold to check. Is this thing really 2% hydroquinone or is it 10%? Because what has happened is some of the products we sell in Nigeria have gone abroad and been flagged. In Nigeria, they're supposed to contain 2%, but when they got to the UK, they found it contained 10% hydroquinone. And so that cosmetovigilance should have picked that up here. So those are some of the things we need. And then I like the fact that NAFDAC recently raided the trade fair, people selling a lot of dangerous lightning products. Yeah, it's business. And some people say, oh, you're spoiling business. But if your business is harming people, then that's not a legal business. We should be beyond just making money. If your business is to sell something that's going to damage people's skin and liver and kidney, then you are in the wrong business. There's no difference between you and somebody that's selling cocaine. But that's the truth, because you are just capitalizing off people's, downfall. And that's not a business that anybody should defend. So I would say it's super important that we have more cosmetovigilance. We make sure that if people are selling harmful products, that they are prosecuted, because they are going to damage the lives of people in the future. And we just keep pushing. I think it's very important for the regulatory bodies to work closely with dermatologists, people who actually see the patients and the adverse effects that some of these products are causing, so that they have a clearer picture of why they need to be more strictly regulated.
Yeah, in terms of regulation, I actually read a report where someone was saying that Nigeria is the dumping ground for banned skin products that has been rejected in the UK, in the US, and yeah, it just makes me feel like we don't know the kind of things we rub on our body just because we want to have a certain skin tone.
It's a big problem. It's a big problem. But I believe that, and then also we are doing ourselves, as Yoruba will say, because the organic craze came, and people were producing all kinds of toxic substances, putting high steroids and hydroquinone in products, because they don't know. All they know is people want to be fair. Okay, so if this one makes you fair, let's put as much of it as possible, so that they can be fair and buy more, without thinking about the safety of these products, of these formulations. But I think people have seen the damage they've done. A lot of people entered one chance in quotes with these organic products, and they ran far away from them. But I'm happy that now we have Nigerians formulating products that are safe, that are good, that are effective. And I hope that continues. So we can have our own produced products that are for the black skin and are also safe and effective.
Yeah, I think with the amount of beauty conferences, skin conferences that I've seen in the past year, I think I attended 2 or 3. I think we're beginning to wake up and we're beginning to, try to talk about this, articulate the effect and how to approach safe
skincare practices.
Dr. Cole-Adeife, this session was extremely insightful. Personally, for me, as someone who is writing about colorism in Nigeria, and I want to believe people who are watching have actually learned so much. I think this session has been amazing, insightful, educative, and I would say for everyone listening that it was intentional, that we actually wanted Dr. Cole-Adeife on this first episode of Derma Dialogue so she can lay the foundation on what it means to approach safe skin procedures in Nigeria, what it means to feel comfortable in your skin, what it means to understand that you are enough and your color, how you look, your height, your size does not define you as a woman or as a person. So I personally would say thank you for being available, for taking out time out of your busy schedule, because I know you're a very busy woman. And for people who are interested in contacting Dr. Cole-Adeife for skin care consultation, please, you can reach her through her handle and she would take care of you. That's what I would say. She's taking care of me and I know she will take care of you. So thank you very much for joining us on this first episode, this pilot episode of Derma Dialogues. And until we see you again, stay safe and take care of yourself. Thank you.